Peace be to you all. Assalamu alaikum. Omar Abdul-Malik, physician assistant and doctor of health education here. I want to talk to you all very briefly about Breast Cancer Awareness Month in these last few days of October. So there are over 300,000 women who are diagnosed with breast cancer in the United States of America. Many of the women who die of breast cancer are African American women. They actually have the highest rate of death due to breast cancer, more than any other group. That's why it's important to get checked for breast cancer via a mammogram. First, it starts with self-checking. Don't be alarmed if you find lumps. I've had many women coming to me in the private practice where I work, and other women who I've known who have been very fearful when they find lumps. And I tell them that quite often the lumps that you find in your breast are benign, so non-cancerous. So it's important to do a follow-up with a mammogram. If you find a suspicious lesion, you may have to undergo something called a fine needle aspiration in order to find out whether it's malignant or benign. This is considered the gold standard, and that's always under the guidance of a board-certified physician. Now, having said that, there are different types of breast cancer. So it's believed that African American women have a greater propensity of something called a triple negative breast cancer. This is a combination of low estrogen receptors, progesterone receptors, and low human epidermal receptors, or human epidermal growth hormone. So you've got to kind of educate yourself. There's a lot of good information about this on the internet. And you can ask either a clinician or a health educator like myself who can correctly educate you about that. Now, as far as risk factors are concerned, things like smoking, obesity, anything that deals with radiation. So if you work in a job where you're exposed to radiation, or if you've had to undergo radiation for things like maybe a hyperactive thyroid. And many of my patients have got what they call comorbidities, that they've had hyperactive thyroids and goiters that had to be treated by radiation, and then many of them also have breast cancer. So it's sometimes it can be difficult to tell if that was a result of the initial radiation therapy that they underwent for that thyroid. So again, you need to check with your doctor about that. But this is a very important matter because in many cases, if it's caught early enough, breast cancer can be effectively treated. And now there's a lot of controversy with the use of the mammograms. Sometimes there's people who argue that it leads to unnecessary procedures like lumpectomies and in some cases even mastectomy. So that's the total removal of the breast. But that's the best thing to do is to try to get it detected as early as possible. Also, as a final note, please abstain from things like smoking. I have a lot of patients who smoke, and I try to get them off of nicotine, that nicotine habit with the smoking. That's one of the things that we call a modifiable risk factor. You don't have to smoke. So it's a risk factor that you don't have to have. It's estimated that women between the ages of 40 to early 70s should get a mammogram screening every 2 years. And again, don't be immediately alarmed if you find anything on the mammogram. I've had that happen. Women call me, they're crying, and it says that I've got some kind of mass. It says, well, it can't be determined whether it's benign, non-cancerous, or malignant until you get that fine needle aspiration. And then that's examined by a pathologist. And that's always the board-certified MD. Okay, that's it for now. If you have any more questions about breast cancer, see a local health educator, or you can even contact me. I will help you to the best of my ability. I should say that I am not a gynecologist, nor am I an oncologist. So that's where you would want to contact your primary care provider. All right, I wish you guys the best of success in your positive endeavors. If you want to be a physician assistant like me or a health educator, please feel free to contact me. Take care. Peace.